So my name is Alex Evans, I'm one of the osteopaths at Kube Medical in Swindon, and I'm going to talk to you today about setting up your home office. In the times we're living in currently, more and more working from home. Over the 21 years in my practice, I've worked with many postural issues involved with sitting in front of a computer screen or at a desk. And during these times, it's becoming more challenging to sit correctly when working from home without the equipment that perhaps your company will provide for you in an office. So I'd like to just provide you with a reason for why we should improve the way we sit today, how we can sit better, and some tips that can help you. And in the future, we'll look at some exercises that can help you when you work at the desk as well. So firstly, why do we need to sit properly at the desk? What sort of problems do I see regularly in clinic because of poor posture? Well, it's obviously the ones that people think about immediately. Neck pain, with the head dropping forward, tight traps, levator scapulae muscle, mid-thoracic pain, low back pain. Those are the classics we tend to see. Shoulder pain is very common as well. And then also poor tighten hamstrings in the lower extremity. People often don't think about the legs, but when we're sitting for a long period of time with our knees flexed like this, our hamstrings are shortened, tightened, and we find that they can get quite tight, causing some of the low back problems. So I'm just going to look at a few areas in the spine, using the spine we have here to show you how we really want people to be sitting when they're at the desk, because to understand it well, we need to look at the anatomy so you can get yourself into the best position. And a lot of people will find that when they're sitting on their low back, they're sitting on the sacrum, and that's putting tremendous strain on the posterior muscles of the spine. They're fatiguing, they're tiring, you're off midline, so the muscles aren't in balance, they're overworking. These muscles, they're active movers, they're not designed to be postural muscles, so they fatigue, become uncomfortable and start to give you some discomfort. When we're sitting properly, we actually want to be sitting on our pelvic bones at the base of the pelvis here, and then that allows the spine to stack properly above it. So we want to move from a position here to a position where we're comfortable here. And there's certain things that we can do to achieve that. Firstly, and most importantly, it's looking at our chair. The chair is key, and really we should have some basic functions within the chair to help ourselves sit properly. Obviously, we need a good back support. It's good to have a seat that will tilt, because roughly speaking, you want an angle of about 100 degrees between the hamstring and the calf here. And obviously you need a chair that goes up and down to get that correct height. So the first thing you need to do is make sure that your height is right. If the angle here is below that 100 degrees, you want to raise your chair. Secondly, to maybe help with the sitting position, to take you from here to here, it's good to alter the tilt on the chair. Then we want to think about sitting properly in the chair. Is the lumbar lordosis, the base of the back, properly protected? If it's not being supported and we don't have an adjustable lumbar support, a simple trick is to get something like a rolled up towel, lumbar support into the back to get you sitting nicely. You can see as soon as I put this in here, my posture immediately changes. It goes from here to a nice, comfortable, stacked position where I want my spine to be. I want to be sitting on the pelvic bones here. You can feel them underneath when you rock from side to side. This allows my spine to stack above the pelvis, my head to be in a better position, and my muscles to relax, because I'm now allowing the skeletal system to do what it's made to do. So we want to think about that immediately. Once we're there into that good position, we now want to think about some of the things surrounding us. Ideally, if you're working from home and you're using a laptop at the moment, you do need to do something to separate the screen from the keyboard. It's usually good to have a separate monitor, because really with a laptop it's virtually impossible to work for a long period of time in a good ergonomic position, because the screen will always bring you into a tightened anterior position. And what I'm noticing with lockdown and more people working from home is I'm seeing a lot more shoulder problems coming into play in clinic, because people are working directly over their laptop using the mouse pad here, and they're starting to drop forward. So we want to think about being in a position where when we look at our screen, we should be able to put our hand out about 180 degrees, drop it down by about a degree, because that's our natural gaze, just looking down slightly, and that should roughly be the centre of the screen. So for example here, the screen I have, I'd want to use something to raise it slightly, so because at the moment it's too high for me. So there's some of the basics, because once you're actually in that nice position, your gaze is working in the right way, you're looking at the centre of the screen, so you're not having to peer in, look up, look down. You're just in a nice relaxed position with everything aligned. This next thing we need to look at is actually the height of the armrests. When we're thinking about the armrests, we want to have them in line with the keyboard. So it needs to be at that height across the desk. So if I had an armrest on this chair, it would be at about this level. So it's nice and supported, and I can easily use the keyboard well supported and not having my wrists extended or overly flexed, which can tend to cause some issues with the wrists. The other thing that I like to get patients to do is to look at their mouse use. The mouse causes no end of problems for many patients: wrist, elbow, shoulder, neck, and it can be remedied in a couple of ways. If you're doing an awful lot of mouse work, I would usually recommend that my patients have two different types of mouse that they can use. One traditional style mouse, and perhaps a vertical one as well, so they can change the orientation of the wrist and the way the forearm is used, and it takes the pressure off rather than just repeating the same thing over and over again in the same position. The other thing I like to do with my patients, many people will just pop a mouse pad down and not move it in any way. It's quite nice sometimes just to change the orientation of the mouse pad, so you're just using it at different times of the day in different places, because when you do that, it allows you to use different parts of the muscle group coming down through the upper back and shoulders, and it takes the pressure particularly off the levator scapulae muscle here, which is a common problem that I find being very tender in many of my patients, and it's something that's nice to do. Most of the problems sitting at the desk in a poor posture, it's the length of time we're doing it. The body craves movement, it wants to move. Every muscle is engaged in movement, it doesn't like to be stuck there for too long. So if we can try and do something that just changes the way we're moving it rather than being fixed there for 8 hours a day, it can really make a quick change for many people. So when we look at this, the very simple steps that we can take very quickly that usually help to improve the discomfort people face. The next time we discuss this, we'll look at some of the exercises that we can do in front of the computer screen that can help you through the day. There's some good simple exercises that usually take no more than 2 minutes that can be done a couple of times during the course of the day that can be very beneficial to help you manage your time in front of the computer screen.